and well. Dr. Phil Moore joins us now, Chair of NHS Clinical Commissioners Mental Health Commissioners Network. Hello, Phil. Welcome to the programme.
Hi there, Tony. Thank you for inviting me.
That's all right. I mean, the irony is not going to be lost on anybody, is it, that these crisis teams, which are so important, appear in the large to be in crisis themselves?
I think it has been a situation where for many years mental health has been underfunded and services have run down over a period of time, and I don't think we're in a good situation. My heart goes out to people like Abby and the situation with her brother Pete, because that should never happen. There are far too many suicides in this country. In London alone, there are 14 every week, and we have to do something that enables people to get easy access to help when they need it.
So money is one issue, but Abby there was talking about having to have a GP referral to get access to the crisis team. Is that wrong then? Should people automatically be able to just dial a number and say we need help?
My view is that crisis lines should be exactly that, and you don't put barriers in the way of people getting through to crisis help. There's been a lot of money put in. The government has put in £400 million into developing crisis intervention and home treatment teams. They've also put in almost £250 million over 4 years to develop what's called the psychiatric liaison teams, which are the teams that work with A&E departments if people happen to turn up there, so that wherever people turn up, it's never the wrong place. There's no such thing as a wrong door. Every door should get them to the right kind of help that they need.
And yet, anecdotally, and Abby reflected that as well, we've heard other stories today where the actual human beings on the other end of the phone don't seem equipped to be able to deal with some of the problems they're faced with. So whether it's one of long-term training as well. And this issue of 24-hour, 7-day-a-week services, of course, the nature of these crisis teams means that a lot of their business will take place outside of office hours, and NHS England said they're not sufficiently resourced to operate those hours. So whose job is it to allocate funds? You've said the government chucked at 600 million quid or so at this issue. So whose job is it to make sure it gets through to the front line so people who are correctly trained can answer the phone?
Well, that's part of the job of the clinical commissioning groups, and they're led by GPs who come into contact with people like this on a daily basis. And we are working very hard to try and make sure the money goes to the right place. But we need to understand that the NHS is in real difficulties with its money at the moment. It's pretty tight. There's savings having to be made everywhere, and therefore clinical commissioners and mental health commissioners are actually having to make their case against very many competing demands. The government has put in place something called Core 24, which is a 24-hour service to deal with this kind of urgent service in A&E and other places, and that really dictates the kind of standards that should be in place, and many groups are meeting those, but others have still got a way to go.
Just finally then, Phil, what do you suggest people do? If there are people listening to this who may be in the position that Abby found herself, or other callers we've had on 5 Live today, and they want help from a crisis team and they're not getting the service they feel they're getting, and they're panicking a bit, where should they go at that point?
Fine. In many ways, it doesn't matter where they go, as long as they don't give up. Don't stop. If there's a crisis line, you can't get through, and you can't get through to your GP, the Samaritans can help, and maybe it'll put you into contact with it. And a last resort is always to turn up at A&E, where there should be a liaison psychiatric team who will do a proper assessment and get somebody to the proper help that they need. A&E isn't the ideal place, but if all else fails, you can always go there.
Phil, thank you. Dr. Phil Moore, Chair of the NHS Clinical Commissioners Mental Health Commissioners Network. Now, I'm going to give you a phone number in a sec, so if you want to grab a pen, I mentioned I'd give it you again.